Bismillah ar-Rahman ar-Rahim. My name is Hamza Hanif, and today is our presentation. I'm a member of Group F, and so here we start. These are our group members. So, anatomy of endocrine system. The main endocrine glands are the pituitary, thyroid, parathyroid, pancreas, adrenal, and gonads. Testes and ovaries, the glands synthesis hormones which are released into the circulation and act at distant sites. Disease may result from excessive or inadequate production of hormones or target organ hypersensitivity or resistance to the hormone. Although some endocrine glands, parathyroid glands and pancreas respond directly to the metabolic signals, most are currently by hormones. Released from the pituitary gland, a wide variety of molecules act as hormones. Peptides, glycoproteins, steroid hormones, or estradiol, testosterone, thyroid hormones. So the principle of endocrine glands is the hypothalamus, pituitary gland, thyroid, parathyroid. So common clinical feature in endocrine disease. So we will start from the weight gain, hypothyroidism, weight loss. So in weight loss in hypothyroidism, diabetes mellitus, a short stature, constitutional non-endocrine system disease, delayed puberty, constitutional non-endocrine systemic diseases, hypothyroidism, hypo, hypo pituitary, primary gonad failure, menstrual disturbance, diffuse neck swelling, excessive thrust. So, so this one I think is the important slide. So we will start from the general observation. So Dr. Haroon, he's gonna start from the general observation.
Okay. Assalamu alaikum. My name is Muhammad Haroon Aslam and I am finally the MBBS student. I'm here to show how to examine endocrine system. So let's start. What is your name?
Muhammad Arslan,
Age?
23.
Address? Address? Okay, in general observation, first take a thorough look on the patient's body and notice everything like mental health, demeanor, e.g., for example, any agitation like shivering in the body, appearance, central obesity, pale color, hair distribution, for example, absent axillary and pubic hair in hypothyroidism, and hirsutism, overgrowth of hairs. So look at the body of the patient thoroughly and notice these things in general observation.
So after that, from general observation, we will go through the hands, how to examine the hands. So Dr. Haroon, can you
आप एक दफा go through करो ना ये वाली फिर बाद में सारी examinations करो.
what I'm saying, you can go through.
Okay.
Yeah.
In hands, we'll see for skin crease and pigmentation, like in Addison's disease. We see any enlargement of hands and sweaty hands. So please, can you move forward your hands? Okay, it's normal.
Okay. After that, we will check for the pulse and blood pressure. So we don't have the
Apparatus.
apparatus. So
Yes.
after that, we going for the eyes.
Yes.
And then we'll go for the face, neck, breast, bones, genitals, legs. So we will go into these slides. So these are the hormones secreted by major endocrine glands: anterior pituitary gland, posterior thyroid gland, parathyroid, and pancreas. So these are the hormones. So anterior pituitary gland, growth hormones, thyroid stimulating hormones, adrenocorticotropic hormones, follicle stimulation hormones, and posterior pituitary gland, and antidiuretic hormones, oxytocin, and thyroid gland, thyroxine, and calcitonin. Hormones secreted by gonads, testes, and ovaries, and hormones secreted by the other organs: thymus, kidney, heart, and placenta. So here the clinical examination. Thyroid gland. The thyroid gland is a butterfly shape with two symmetrical lobes joined by the central isthmus that normally cover the second and third tracheal ring. The gland may extend into the superior mediastinum or may occasionally be entirely retrosternal. Rarely it is located higher in the neck along the line of the thyroglossal duct if situated at the back of the tongue. It may be visible through the open mouth. So here the Dr. Haroon will show us how to examine the thyroid gland from the back side. So please can you show us?
Yes. It is normal.
Okay. So here is the hypothyroidism and hypothyroidism, the differences. So generally we will check for the weight loss, whether it is loss or increase, heat intolerance, anxiety, fat, fine tremors. And in hypothyroidism, generally we will go for the low metabolic rate, weight gain, sensitivity to the cold, mental health, and depression. Examination sequence. Generally look for a sign of weight loss and again agitation, restlessness, or apathy and lethargy. The facial appearance and expression. Examine hands, pulse, and blood pressure, arms and legs for skin abnormalities, muscle power, and the deep tendon reflex. The eyes for exophthalmos, diplopia, conjunctival edema, on conjunctivitis, corneal ulceration, lid retraction, and lid lag. So Dr. Haroon will show us how to examine the sequence of the examination, how to approach the patient. Yeah.
Yes. When we see the eyes, we will see for exophthalmos, like bulging out of the eyes, and ophthalmoplasia, any paralysis, and visual field defect. For exophthalmos, we stand behind the patient. It's difficult to do here. And from the backside, we see for the eyes or any bulging out of the eyes. And for ophthalmoplagia, can you please move your eyes with my hand without moving your head? Okay, perfect. And visual field defect, we checked it out by Snellen's chart.
So there are some abnormal findings: shape, surface, and consistency. Simple gustures are relatively symmetrical in their early stage, but often become nodular with time. The grave disease, the surface of the thyroid gland is usually smooth and diffuse. It is irregular in uninodular or multinodular gusture. So parathyroid gland. There are usually four parathyroid glands which lies posterior to the thyroid. Each is about the size of the pea and the procedure. Parathyroid hormones, a peptide which increase the level of calcium in the blood. Each parathyroid gland is made up of chief cells and auxiliary cells. Chief cells secrete parathormone. Auxiliary cells are degenerate chief cells, and their function is known. However, these cells may secrete parathormone during pathological condition called parathyroid adenoma. Number of auxiliary cells increase after puberty. So history, examination sequence. So first we will go for the look at the neck for scar and previous surgery, assess mental state, take the BP and assess the state of hydration, look at the hands, ask the patient to make the fist and assess the length of the metacarpals. Test for Test for the muscle weakness and hyperplexia. Test of late tetany. Place BP curve of the upper arm and inflate above the systolic pressure for the 3 minutes. In the hand carpal muscle contraction produce a typical picture with the thumb abducted. The proximal interphalangeal distal interphalangeal joints extend and metacarpopharyngeal joint fixed. So look for the evidence of recent fracture and bone tenderness. Use a slit lamp to look for corneal classification. Perform urinalysis. Ask about recent thyroid or neck for scar of previous surgery. Polyuria, polydipsia, or renal stones, fractures, abdominal pain, or constipation, muscle cramps, confusion, or confusion. Abnormal findings. Parathyroid tumors are very rarely palpable. Finding in hyperthyroidism may include altered mental state, dehydration, proximal muscle weakness, fractures, and bony tenderness. In long-standing hypercalcemia, corneal calcification may be present. Renal stone may produce hematuria on 6 testing. In moderate severe hypercalcemia, hyperplexia, and positive Trotter sign may be present. 2 minutes remaining. So Dr. Haroon here, he will take the history and examination sequence. He will show us how to take a history and how to approach the patient and examine these.
Okay. Let me summarize because our PPT is lengthy. So we will summarize it by the examinations. As we already done the general observation, we already seen the patient's hands, eyes, fur face. We see the features of Cushing syndrome, like moon-like face, Addison's disease, and acromegaly, like enlargement of the toes. So please, can you move forward your hands? Okay. Uh, for the neck, as we examined already, we check for the goiter as it is smooth or nodular. And for the breast, we check for gynecomastia, male breast tissue swollen due to decrease in testosterone or increase in the estrogen. And for galacturia, which is milky nipple discharge unrelated to normal milk production. And finally, for genitalia, we look for pubertal development, and in males, we check it for testicular volume. We also check patient's height, weight for the BMI. That's all.